Welcome to Friday's edition of COVID-19. Korea's daily tally is holding steady on the 600 level, much to the concern of health experts who believe caseloads may surge in the absence of tougher prevention measures given the presence of variants. We have details later on the program. Let's start now with the pandemic updates with our Kwon So-ah. So what is the latest here in Korea ahead of the weekend?
Well, Sunny, the work week is ending with a slight decline in cases. The number of daily infections has dropped to 673 as of 12 a.m. and that includes 652 domestic transmissions and 21 cases from abroad. And with that, the total number of accumulated cases stands at 112,789 and the death toll at 1,790. Now, infections were confirmed in all 17 provinces or major cities on this Friday, with numbers above 200 in Seoul and Gyeonggi-do province. And new infections were reported at workplaces, private gatherings, restaurants, pubs, and many other venues. And in the past week, the numbers were fluctuating between the 500s and also the 700s. And with that, the number of daily domestic infections in the past week stood at an average of 626.
Right. And instead of imposing tougher social distancing measures, the government appears to be focusing on swift testings.
Right, Sunny, and that especially regarding people with COVID-19-like symptoms. So 11 regions so far have implemented administrative orders regarding mandatory testing, and that rule is in effect in the capital Seoul and Gyeonggi-do province since Thursday, and also in Incheon and Busan since Wednesday. So anyone who is recommended to get tested for the virus by a doctor or pharmacist due to fever, sore throat, or other suspicious symptoms must get tested for COVID-19 within 48 hours. According to government data, 55% of people linked to cluster infections in March did not get tested for at least 3 days despite showing symptoms, with many of them continuing their daily routines such as going to work. 22.5% of roughly 5,000 infections during that span occurred due to late diagnosis. And along with faster detection, the government is also speeding up the vaccination process with its aim to achieve herd immunity by late autumn. And here's Prime Minister Yonsei who expressed the government's confidence in doing just that.
Vaccination centers have been expanded to 175 yesterday from 71 last week. The number of vaccine recipients has surpassed 90,000 in a day from around 40,000.
And we have here the number that surpassed 90,000. Over 92,600 people have received their first shot of vaccinations on Thursday. And now let's move on to the international updates. We are seeing a rise in daily infections day by day, with over 845,000 cases reported in the past 24 hours as of noon Korea time. And especially serious is the situation in India, which posted over 200,000 infections in just a day and is having shortages in hospital beds as well as oxygen supplies. This is the second country after the U.S. to hit that daily record high. And let's take a look at the total numbers here. India at almost 14.3 million, the U.S. at 32.2 million. And there are also resurgences in Turkey and Germany with 4 million and 3 million cases, that is, respectively. And those are the updates I have for now. I'll be back in a bit after the government briefing. Back to you, Sunny.
All right, so thank you for that. Right, back here in Korea, despite the rising number of new infections in recent days, the number of severe cases has not been marking an alarming surge. For more on this reality and other local news, I have Kim Sung-yeon here in the studio. Welcome, Sung-yeon.
Hello, good afternoon.
Right, so while we are witnessing great numbers of new cases on a daily basis, the number of people suffering from severe symptoms is not rising.
Right, so that seems to be the case. New daily cases here in Korea hovered around 700 on Thursday, but the government says the number of seriously ill patients patients appears to be rather stable in the recent days, and the government's focus now is to minimize the loss of life rather than trying to reduce the overall caseloads. Now, sporadic clusters across the nation are continuing to hinder Korea's containment efforts. However, the government noted that the number of critically ill patients and the number of deaths have not risen in proportion to higher caseloads. The average number of daily cases now stands at 645 over the past week, but the government said fewer than 100 of them are serious illnesses. By comparison, during the peak of the third wave in mid-December last year, Korea saw a weekly average of 169 seriously ill patients out of 635 daily cases. Also this morning, health authorities said there are more than 600 ICU hospital beds nationwide that are still vacant, showing that Korea's healthcare system is well equipped to handle the outbreak.
Right, well, that's good to know. Meanwhile, health authorities have also found that vaccines have been effective within the high-risk groups.
Right, a senior health official was talking about this in Thursday's afternoon briefing. He did say that vaccines had worked very well in patients at nursing hospitals, for example, as well as other vulnerable populations. Now, as I mentioned earlier, there's been a significant drop in the number of seriously ill patients and deaths from COVID-19 here in Korea, which health authorities attributed to vaccinations. The government reiterated that its highest priority is protecting those in vulnerable groups and that vaccinations will continue to play an important role in achieving that goal. Take a listen.
Vaccinations will be prioritized for people in high-risk groups, including the elderly aged 65 and above and patients with underlying health conditions.
Meanwhile, health authorities are also exerting their full efforts to ramp up vaccinations for the elderly aged over 75. The KDCA also said on Thursday that 104 new vaccination centers were now open nationwide, allowing the country to vaccinate over 70,000 people a day from the previous 30,000.
Vaccinations for those above the age of 75 began on April 1st. And we plan to complete administering the first dose to every eligible recipient in that age group by the end of June.
Furthermore, to detect patients at an early stage, the health officials said they will expand preemptive screening and explore ways to use self-test kits to further scale up Korea's testing capacity. Minister of the Interior and Safety Jeon Sung-cho said reports of health regulation violations at public use facilities are on the rise and vows to closely monitor high-risk venues, including restaurants, cafes, saunas, and daycare centers.
Right. Going back to the topic of self-testing kits, Sung-yeon, I hear the Seoul Metropolitan Government is looking to offer these kits to schools.
Yes, this is a very controversial issue that we are having right now. But the city authorities did say Thursday that it is looking to introduce COVID-19 self-test kits to learning institutions following consultations with the central government. Now, a public health official did at the Seoul city government said at a press briefing that there were many voices in favor of introducing the kits at schools for a trial run during an advisory meeting with experts on Wednesday. The experts recommended the use of the kits, saying there are many advantages, such as being immediately accessible and allowing for the early detection of cases, especially at a time of this community-wide third wave. The official also said that the city government will draw up detailed guidelines on the introduction of self-test kits and their target groups based on the opinions of the experts, emphasizing that all decisions will be subject to consultations with the Ministry of Health and Welfare, the Ministry of Food and Drug Safety, and the Korea Disease Control and Prevention Agency. However, following the city's announcement Thursday, Education Minister Yoon-hye said it is too early to use the self-test kits at schools. You said during a meeting with experts that questions remain over the accuracy of the kits and could undermine prevention efforts at places of learning, and thus they need to be very, very careful about taking these steps.
All right, Sung-yeon, as always, thank you for that report.
Thank you for having me.
Right, it's time now for the regular briefing on the COVID-19 situation here in Korea.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for April 16th, Thursday. As of today midnight, we have 652 new local infections, and 21 new imported cases. The total caseload now stands at 112,789. And yesterday alone, we had 80,863 tests being conducted. And at the makeshift testing centers in the metropolitan area, we carried out 38,656 tests, confirming 120 confirmed patients. And today we have a total of 549 more people being discharged, while 7,937 more people are remaining in quarantine right now. And we have 111 patients with critical or severe conditions, up by 12 from the day before. We had 2 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And as for the recent major local clusters, please refer to the press kits that have been disclosed to you earlier. And here are our details on the status of the COVID-19 vaccination here in South Korea. And yesterday alone, we had 92,660 people getting their first dose of their COVID-19 vaccines, with the total recipients standing at 1,379,653. And out of the Q1 recipients, we have had more than 43,000 people, and we have seen also the administering with the first dose, and our vaccination rate stands at 85.8%. And by nursing hospital, we have about more than 80% of the vaccination rate. And also, as for the first responders, we have 66,000 people getting the vaccinations. And at general hospitals, we have 3,500 completing the vaccinations. And at the COVID-19 treatment hospitals, which is undergoing the second dose of the vaccines, we have more than 68,000 people who have been received with their first dose of the vaccines. And we have also more than 65,000 people who have received their second dose at these COVID-19 vaccines. And out of the Q2 eligible recipients, we have additional 80,000 people, and with the total standing above 600,000, that is, and our infection rate stands at about 14.5%. And as for the senior citizens, we have had more than 340,000 people getting their vaccinations, and they also completed the vaccination rate at about 30% of the rate. And at the nursing hospitals, we have the residents and users above the age of 65, and also their vaccination stands at about 64 and 62% respectively. And as for the post-inoculation adverse responses, we have a total of 12,013 cases being reported, with 86 new cases, and out of them 98.3%, or 11,813, are reported to be mild and common symptoms like muscle pain, headache, or fever. And 119 suspected cases of anaphylaxis have been reported. 29 suspected cases of severe cases have been reported as well, and 52 cases of deaths have been reported, with 1 additional case from yesterday. And as of today midnight, we also have some updates on the post-inoculation adverse responses that are undergoing the probe. And we have been looking at the 32 deaths, the post-inoculation deaths, and so forth. And as for the 32 deaths, we have seen 30 with no correlation with the vaccines, and 2 we are seeing we are waiting for the autopsy results, and we will be providing more analysis going further. And also, we have two cases with the anaphylaxis being showing these correlation with the vaccine, and one is of a female, and also another is of a 20-year-old male who have shown brain blood clots as well. And also, as for the suspected cases of severe cases, we have seen 1 case of death and a total of 5 cases that have been linked to these deaths related to the post-inoculation. And we have carried and we have seen that one death and one case of the suspected cases has no correlation with the vaccine. And one the severe case is the case that we just reported to you about the man in his 20s going through the brain blood clots. And another was also, we have seen a regular, rather than being the rare cases of blood clots, there were general cases. And as for the 8 cases of anaphylaxis that have been investigated, we have seen 3 cases that have been seen with the correlation, and 2 is under probe right now, and 3 have been analyzed to have no correlation with the vaccine. And we also have 104 new vaccination centers across the country up and running right now. And right now we have a total of 175 vaccination centers nationwide. And we believe that we can speed up the process of vaccination for the rollout of the vaccination for those aged over the age of 75. And as for those aged above the age of 75, we have more than 280,000 people receiving their doses of the vaccines. And we believe that with the increase of the establishment of more vaccination centers nationwide, we believe that we have higher capacity of vaccinating on a daily basis. And also before that, we had the capacity of inoculating about 34,000 people on a daily basis. However, we believe that we can inoculate about 105,000 on a daily basis, which will contribute to a significant increase in our daily capacity for the vaccinations. And as for the disabled and the welfare facilities workers and also flight attendants will begin their inoculation as well. And we will also having the inoculation rollout starting from the 19th from next week. And as for the workers and people who are working at the hospitals and also pharmacies, as well as people who are undergoing dialysis, we will be also rolling out the vaccine starting from next week. And also we have more than 1,000 designated hospitals which will be rolling out vaccines starting from next week as well. And as for the recipients, eligible recipients, that is, we will be providing them with text messages and guidance on the vaccinations. And the booking for the reservations for the inoculation, we will also disclose the details of on our Nurijib database, and you can also make reservations by yourself. And globally, on a weekly basis, we are seeing a 7-week increase in the number of total tally, and we are seeing a major resurgence of the virus globally. And there are countries that have inoculated their citizens at a very early stage, and they have been able to ease local lockdowns and social distancing. However, they are still struggling with a high number of daily tally. And here in South Korea as well, our daily tally hovers around 600 and more, and we are seeing more signs of another resurgence, and we are at a crossroad of a possible 4th wave of infections. And up until now, we believe that there are also some facilities that did not comply with these quarantine measures. And if this trend continues, we believe that these daily numbers can increase astronomically, leading to a 4th wave of infection. And our goal of the fighting against COVID-19 is all about minimizing the fatalities, and also this also comes down to supporting those aged over the age of 65, and this is why we are rolling out the vaccines, prioritizing these senior citizens as well as those with underlying medical diseases. And our vaccination effectiveness have shown that after the rollout of the vaccines, we have seen a major decline in the number of infections at nursing hospitals and nursing homes. And also, we have seen a decrease in the new daily tallies stemming from these facilities, which has also contributed to a decline in the number of patients with critical ill conditions and also the number of fatalities as well. And we ask you to comply with the vaccination rollout, and also we believe that effective and speedy vaccination is also very crucial in containing the virus going further. So we ask you to also stay with us and also until the day we reach herd immunity, comply with the quarantine measures on a regular basis as well. Once again, you need to wear your face mask and practice social distancing as well. And if you have any clinical symptoms, you need to visit a screening clinic nearby and get tested as soon as possible. And until you have the test results, you need to wear face masks even when you are at home with your family members. And we need to achieve our goal of reaching a herd immunity by November, and this is our goal of the inoculation plan. And we ask you to also have confidence in our vaccination rollout plan and also participate in our vaccination rollout program going further. And also as for the children, and also if you have any parents who are seniors, you need to also advise your parents to get vaccinated when it's their turn. And please note that vaccinating yourself can protect yourself and also the health of others as well, and it is the most effective and also the most scientific way of protecting your health against COVID-19. If you are eligible for the vaccination, please get the vaccines on the day when you have great health conditions, and even on the day of inoculation, you need to also practice personal hygiene measures like wearing your face mask and washing your hands. And the quarantine authorities will also carry out swift and full-fledged vaccination rollout. We will be cooperating fully with the local governments as well as the medical circles. And last but not least, we have the April 1st. We have seen some of the vaccination centers that have been open since April 1st, and here are some examples. And I visited a center in Cheonan city, and there were 2 timers there. So I believe that this has garnered great attention. So when the doctors are meeting with the people, they are seeing that people need to stay at the vaccination center, the monitoring room after vaccination for about 30 minutes. So for these people with possible allergic reactions, they give the timer set with 30 minutes, and they give the timers of 15 minutes to others who are deemed healthy. So these people get 2 types of timers depending on their health conditions. So I believe that this was very interesting and impressive. And secondly, in Seongdong-gu district, I have visited a vaccination center, and also at the entrance and also the entrance of the inoculation room and the entrance of the monitoring room. At these 2 entrances, they had an air sterilizing filters, and this enabled the facility to have clean and clear air quality. And under this circumstances, the people can also vaccinate it or also watch their conditions with great air quality as well. So people are exerting their full efforts to provide great quality for these people who are eligible for the vaccination. So once again, I extend my deepest appreciation to you for your help. And at these difficult times, we need to keep with the basic quarantine rules, and the quarantine authorities will also exert our full efforts and keep with our basic quarantine measures, and also we will be speeding up our vaccination rollout as well. Thank you very much.
Right, that was Seung-taek with Friday's afternoon briefing. So what was the gist of his address?
He called on cooperation from the nation's people on the government's vaccination program, saying that despite the country being at the threshold of a 4th coronavirus wave, the number of infections at nursing hospitals and nursing homes has actually declined after the vaccination program started. In fact, the first target group of the first quarter's vaccination program, more than 85% of vaccinations in that group has already been completed.
I see. All right, so thank you for that.
My pleasure.
Right, also on the local front, a robot barista is working to ensure a cup of coffee and social distancing at a cafe here in Seoul. Our Jeon Sung-cho is out on location. Hello, Sung-cho.
Good afternoon, Sunny.
So, Sung-cho, where is the barista?
Well, my very special friend named Baris is right behind me. I'm going to introduce you to him in a bit. Well, he's basically a robot barista who's come under spotlight these days as consumers around the world are shifting towards a contactless world. His specialty is pour-over coffee or hand-drip coffee. That's how we like to call it here in Korea. Let me show you how it gets done. So follow me. Let me place an order first. 안녕하세요. 저 로봇 드립 서울 드립으로 따뜻하게 부탁드릴게요. 네, 감사합니다. All right, so I just placed an order and also specified what type of bean I want to use because it can really affect the brewing process in a bit. So Baris just started working on making my coffee right away. All right, so Baris' coffee artistry is based on this unique algorithm that's designed by skilled baristas and computer programmers who studied brewing and extraction processes of coffee and also taught the machine how to bloom coffee grounds. And that's a coffee term for what you're going to see in a bit, this perfect circular motion in order to brew the coffee in a perfect stage. All right, so it is busy grabbing the pot right now. It's about to pour hot water over this filter, and then you see coffee grounds inside right away. All right, so this is the blooming stage, and the key is consistency. And you have to do it on a very consistent rate, very slowly. And this is why making a pour-over coffee can be so tricky because this process is entirely manual, which means you can control over basically every aspect of the process depending on the bean types or what kind of flavor you're going for. So you got to have a very steady hand, and you got to have a lot of patience too, because this process alone can take about 3 minutes. But for Baris, it's no problem because it can provide consistent and controlled coffee quality without human involvement. So over the past year, Baris has made over 30,000 cups of coffee, and that's incredible. And plus, he's become especially useful these days during this current coronavirus era since terms like contactless and on-tact have gained new prominence. All right, so to learn more about him, I'm going to speak to one of the officials from the company that developed Baris. Good afternoon.
Hi, welcome.
All right, so can you tell us how Baris is being accepted by customers these days?
At first, people like the way how softly the robot drinks the coffee. It's something that they have never seen it before. And I remember a comment made by an early customer saying that this is the first robot that was used in their daily life, and I really liked it. And recently, mainly due to the COVID-19, people's interest in contactless service has increased, and people find the robots more hygienic since there are less human interactions.
Right. I mean, these days, less humans means less chances of catching the virus, right? Yes. So are you working on any new features for the next version of Baris, perhaps?
The main reason we use the robot is to help and support baristas and other workers with their labor burdens. And other technologies that we are developing called in-store technologies are aimed to optimize the retail by minimizing the space necessary and by analyzing the consumer behaviors made in the retail to help decision-making processes with data.
All right, thank you so much for your answer this afternoon. Thank you. All right, so I think my coffee is done right here. Okay. So yes, drinking coffee has become an integral part of our society, and robot baristas is an evolving technological development that is made to deliver great cups of coffee as efficiently as possible and to cut down on several factors, including human deficiency like falling sick, which is a very crucial, very important element in this current era when we have this very contagious virus lurking around. So here you can enjoy an entertaining display of coffee artistry and science while having a minimal contact with other people. This has been Jeon Sung-cho, and back to Sunny in the studio.
All right, Sung-cho, enjoy your coffee and thank you for that report.
전 세계 주간 신규 확진자가 7주 연속 증가하고 또 전 세계적으로 유행이 재확산되는 모습을 보이고 있습니다.
변이 바이러스 확산 차단을 위해 해외 입국자 등 격리 면제자에 대한 요건 심사를 강화하고 국내 입국 후에 5에서 7일 차에 PCR 중간 검사 실시 여부 등 모니터링과 관리를 강화하도록 하겠습니다.
Coronavirus variants are fueling resurgences across the globe, while vaccination efforts are being challenged by supply shortages and safety concerns. Now, for more on these huddles, I have Professor Moon-kyu from Yonsei University. Pleasure to have you with us, Professor Kim.
Thank you for having me.
And I also have Dr. Seung-taek from Institut Pasteur, Korea. Welcome back, Dr. Kim.
Good afternoon.
Right then, Dr. Kim, what is the status quo with regard to coronavirus variants here in Korea and elsewhere around the world?
Well, in the around the world, I know some countries actually just this variant virus is becoming more dominant. It's like just the thing we actually witnessed like earlier last year. There was many just talks about some D614G variant. Now that is more just dominant. That it also just replaced the very ancestral form of the viruses. But this variant concern, especially like British and then the South African and also Brazilian things, may have some potential to just dominate and then replace some current just virus isolation. We'll have to keep watch on it. And then for the domestic issues, I know some authorities actually just watching on keeping just a focus on the variants potentially just imported from the foreign countries. But I don't know how just frequently just sequencing is being done on some domestic cases. So I do not know how many proportions of the new confirmed cases are from the variants. But this is certainly just the thing we have to keep an eye on it. And then the variants, actually, we know we somehow just assume that variants seems to just always just coming from outside. But variants can emerge from just domestically. So we have to focus on this domestic, just potential emergence of the domestic variant issue as well.
Right. And meanwhile, Professor Kim, another worrying reality is the fact that younger adults appear to be more vulnerable to variants. Could you explain this for us?
Well, if you look at the age distribution of confirmed cases inside Korea, about 40% happens at the age group below 40. And the peak is the 20 to 29 age group. There was a report from Canada that the peak age group is between 20 to 39, and more young patients are admitted to intensive care unit. And I think it's same for USA and France. There's something common between Korea and other countries, that the youth are active socially, and they are the main working group, so they have more chance to get exposed to the COVID-19. But also there are some differences, and I would say that in Korea, domestic cases have only the previous case, just as Dr. Kim mentioned, but from USA, Europe, South Africa, and even Brazil, they have a new strain. And the second difference is the vaccine program. Korea is just at the beginning, but other countries are far advanced, like UK. And if we look at Israel, they have done more than 60% of their total population getting the second dosage. But they say that the portion of the young people admitting to hospital are increasing. So that means the new strains might cause more infections in the new group. Anyway, we used to say that the new strains just is more infectious and not causing more mortality, but we have to be concerned from the report from Brazil. There's an area called Manaus in the Amazon area. They say that the mortality rate is more than 2 times higher than the previous reports. And they even say that the reinfection with the new strain is about 61%. So we have to be vigilant, I would say, especially for the young people, and speed up the vaccine program and maintain the quarantine measures.
Right, and speaking about speeding up the vaccination program, here in Korea, authorities have opened up now. We have in total 145 vaccination centers, I believe, and the goal, according to the afternoon briefing today, is to vaccinate 100,000 people per day. What are your thoughts on our efforts?
It's good that most of the Koreans are welcoming the vaccine program, and we expect the government to match with our desire. And also, the side effects should be closely monitored subjectively, because still we have some issues like AstraZeneca being some blood clot issues, especially for young females younger than 30 age, and especially on the contraceptives. And we just talk about vaccine efficacy only, but I would say almost all the vaccines finishing their clinical trial, they are very good in preventing mortality, almost reaching 100%. So I recommend our people to get vaccinated if you have a chance. And still, we have new ones coming, like Novavax and other vaccines. And I wish that the Korean government listen to the experts' opinion. And if you look at the lessons from Israel, the vaccination speed was very fast at the beginning of the program. But after they reached 40%, they had a speed down. Somehow, I mean, there are some people who are very reluctant. So our government should be very proactive to plan for that situations also. And the government should be ready to persuade them to get vaccinated if they have a chance.
Right. Meanwhile, a recent study over in the US explored the possibility of COVID-19 infection post-vaccination. Now, for the results of this study, I have Professor Francesca Torriani at the University of California, San Diego live on the line. Welcome, Professor Torriani.
Thank you so much for inviting me and allowing me to share with you this important finding.
Thank you very much for your time, of course. Professor Torriani, let's begin then with the findings of the study itself, which I understand included individuals who had received either the Pfizer or Moderna vaccine in the US.
That is correct. On December 16, we started our vaccination campaign at UC San Diego and across the UCs, the University of California. And between December 16 and February 9th, when we closed the study, we vaccinated more than 36,000 healthcare workers. We only 379 of our healthcare workers who were tested on a weekly basis and were surveyed for symptoms, but we tested asymptomatic healthcare workers also. 379 tested positive 1 or more days after the first vaccination. 2/3 of these healthcare workers tested positive within 2 weeks after getting the first vaccine. And what is important here is that only 7 tested positive 2 or more weeks after the second vaccine. So that is a reduction of 15-fold from 2.5% of the people who tested to 0.17%, which is fantastic. In addition, most of our healthcare workers who tested positive had either very, very few symptoms or no symptoms when they tested. And they were found to be positive because of our weekly asymptomatic testing.
I see. Professor Torriani, broadly speaking, what do you believe are the implications of your study then?
It means that these vaccines are also effective at preventing infections, symptomatic or asymptomatic. They're not only effective at preventing severe disease or death, they're also effective in preventing disease, period. Vaccination of all people eligible as fast as possible, as was said just before me, is the only way to curb this pandemic. by vaccinating everyone who can be vaccinated, we may be able to reach herd immunity soon enough.
Right. All right, Professor Toriani, thank you very much for making the time to join us live with your thoughts.
Thank you.
Right then, Professor Kim, let's now talk about the vaccine-induced protection against variants. Pfizer claims a study in South Africa proved that its vaccine is 100% effective in preventing illness, while Israel claims that Pfizer's vaccine's effectiveness may be lower against the South African variant. Could you tell us a bit about this discrepancy in finding?
Pfizer reported the first phase 3 trial in last year, November, and they reported the vaccine efficacy about 95%. And recently, they added more subjects, and the report says their efficacy is about 91.3. I think it's because the emergence of the new strains. And they also did a pilot phase 3 trial in South Africa from the volunteers with a number of 800. And they say the vaccine group had no infections, but the control group had about 9. Which 6 out of 9 is the South African variant. So they insist that it is effective. But if we look at the Israeli report from Tel Aviv University with Clalit, they reviewed 800 confirmed cases, and 400 are vaccinated with Pfizer, and 400 were not vaccinated. And they say that the vaccinated group had about 5.7% infected with the new strain, but the control group had only about 0.7. So they have a high emergence of the mutant infection from the vaccinated group. So it's a real-world data. It's different from the efficacy. So it has more power, evidence. So bigger study is needed, but we should be vigilant. But as I mentioned from the previous question, the mortality is very low right now after the vaccination. So anyway, even though you got vaccinated, even though you got the infection from the new mutant, you might still have a protection from getting mortality.
I see. Meanwhile, Dr. Kim, let's turn to treatment efforts on the local front. Now, plasma therapy has been found to be efficacious both against the UK variant and the South African variant, while the antibody treatment has been found to be effective against the UK variant, but not so against the South African strain. Could you explain this for us?
Well, these two actually seem some different approaches, but they are basically the same. The main component is neutralizing antibody. That's the main key player. But the main also the major differences between two strategies, the convalescent plasma. I would like to say use this analogy, just a monoclonal antibody. This monoclonal antibody using only one kind of bullet, but the convalescent plasma, they are using various different kinds of bullets. So the chances are, if there's some variant, some single kind of just a bullet may target only one, but if there's some change, it might just escape. But in the case of multiple types of the bullets, there is a more chance of at least some of them will just interfere with the viruses. So that's the main reasons. But so to avoid, to just overcome such hurdles, some companies using developing some monoclonal antibodies, they are trying to use some cocktails. So mixing two different kinds, or maybe just more than two different kinds of monoclonal antibodies to target the virus spike protein.
I see. And meanwhile, Dr. Kim, I understand your institute has also noted some progress with regard to treatments against the UK and South African variants. Could you tell us a bit about this?
Well, actually the objective of this study was that earlier just the KDCA presented the efficacy of the monoclonal antibodies, especially from the domestic company. Also, this convalescent plasma for these two different kinds of the variant viruses. So then we were actually just compared to just the test that our some of the repurposed drugs on these two representative variants. So we picked up the some two most sort of just promising the drug candidates. Well, not drug candidates, but the promising targets. So many targets, there are some drugs actually targeting the same just a viral or just a host protein. The one of them is a template-2 protein, which is involved in the virus entry. And the second one is RNA-dependent RNA polymerase, which is the target of remdesivir. So we actually, before the experiment, we expected, well, this is the different target because the vaccines and the monoclonal antibody, they are targeting the viral spike protein, especially receptor binding domain. But these other drugs actually targeting different just the protein. So then we just expected maybe it would be just equally effective, and then we did the experiment, and then the result was actually as we expected. Regardless of the variant issues, those drugs currently being used or just being developed are just equally effective in suppressing the viral replication, even for the variants.
Which is great news, of course. And very briefly speaking, Professor Kim, in part in an effort to deal with the potential widespread case of variants here in the country, authorities have spoken about tightening measures at the country's airports and seaports. Could you tell us a bit about this?
Well, I think we have imported mutant cases, about 400 right now, and most of them are from UK, I mean Kent variant. And about 40% they have no symptom, and 20% they have just coughing without fever. So you can understand that they are having some mild presentations, but still it is wise to put a strict measure against those imported cases. Every person entering Korea needs a negative result paper, and if they enter Korea, they should have a PCR test within 24 hours, and they need another one before they got off quarantine. And if you are positive, they have to stay in an isolated room or hospital with one bed situation. It is because we don't want to get those new mutants get spread in our country. So strict quarantine measures continue to be needed for those imported cases.
Right. All right, Professor Kim, thank you very much for your thoughts. And Dr. Kim, thank you for being here with us today. Right, COVID-19 infections here in Korea as of late have been found to be widespread across many social settings, including the academic arena, places of work and worship, as well as those of dining, drinking and exercising. So do seek to take care. Thank you for watching.